We're here today to talk about the wedge palatal graft. This is a perioplastic surgery technique which is intended to be used whenever you want to enhance and stabilize soft tissues around dental implants. In the clinical case we are bringing here today, well, we have also used it to try to reestablish the interimplantar papilla in the central incisors area. Dentists do not only treat teeth. Well, not anymore. What dentists are really doing is treating smiles. And today's dentists, as modern dentists, well, they should be aiming to give their patients radiant smiles. And I want you to think a little bit about this concept of a radiant smile. Because a radiant smile, well, it can help you from birth for you to express your deepest feelings, for you to grow and to go to school, well, for you to gather friends, for you to enjoy the most simple pleasures of life, and even for you to enjoy aging. Well, and if you're lucky enough, and this can happen to you, if you're lucky enough with your smile, well, it can help you to get such a good job that all you'll have to do for a living is smile. Well, think about this, because it could happen. Another thing that I would like to leave you with is the idea that your smile is always your first word. And I'm going to ask you to imagine, just imagine for 1 minute that your first word is always like this. Well, happily for us, today's gold standard of dentistry is enabling us to change these previous sad smiles into much happier ones, into radiant smiles. And look at this beauty. All this was lost. All this was about to be forgotten and left to die in the old days of dentistry. Well, the patient we are treating today, she had precisely this problem. She didn't want to smile. Well, she in fact refused to smile because she felt that her teeth were coming out of her face. And so she didn't smile. And this was the best picture we could get from her when we asked her to smile, because she didn't want to smile. And all this was due to a severe periodontal problem, which has caused, well, passive eruption of both central incisors with extrusion, of course, and this has led to complete absence of interdental papilla and created a black triangle, a very, very unpleasant black triangle, and also huge recession and extreme loss of attached gingiva. And it's not surprising for us to see that these clinical findings just happen to follow radiology findings. And when we go thoroughly through to the BTI scan of this patient, well, we can see that there is no bone around central incisors. There is huge bone defect around these teeth. And so those clinical findings, well, are just about to be explained. In such a complex case as this, what options of treatment can we think of? Well, we can consider orthodontic extrusion. We can think as well as block grafting. And of course, we can think of implant placement and immediate load. But in any of these options, we'll have to have in mind that we'll have to do proper soft tissue management. And we'll do this, well, by performing perioplastic surgery techniques. Let us see what happened to our patient. Well, she has refused to wear braces, so orthodontic extrusion was discarded. On the other hand, we have decided that block grafting, well, could affect very negatively all adjacent areas. And so our decision was for implant placement and immediate load. And this was because it's a simple procedure well, it's very predictable, and of course, it's probably the best way to preserve already existing architecture. And of course, we can't forget pain, discomfort, and mobility of our patient. We went then to surgery, and in surgery, we have just found what we were expecting to find: huge bone loss around those teeth that we extracted. And so we have decided from the very beginning to do proper soft tissue management. And we've done this by doing a wedge palatal graft. We went to the palate, and to collect the graft, this is just like if you're collecting a connective tissue graft. The only difference here is that you're going to preserve this nice epithelial band to try to get a much bigger augmentation in your problem area. So we have collected the wedge graft. Here we have it. In this particular case, we have folded the graft, and after doing this, we are suturing the graft to the inner surface of the full thickness flap that was previously raised to place the implants. And of course, we've ended surgery with immediate load of both implants. But most important of all, and that was absolutely surprising for us, is that we ended surgery while giving back our patient our will to smile with a radiant smile. This is awesome. That's what's so passionate about our profession. She did want to smile now. Well, we still have a very serious soft tissue problem to solve. We have now a much better situation, but we can't go to our final restorations without trying to solve this defect. And so we have decided to do this. We have decided to do a second wedge palatal graft. And this one, we are going to place it under a split thickness flap that we are going to raise on the vestibular of the implants and extending a little bit to the interimplantar area. We go to the palate again. We collect our wedge graft. Well, there is the nice epithelial band, double-sided vascular area corresponding to the connective tissue of the graft. And we just place it under the split thickness flap. And at this point, it's very important that the epithelial band stays just where you want it to be. And this is the recession area and the interimplantar area. Well, after surgery, we have now a much better soft tissue contour. We have now a much better gingival architecture. Now we have a nice papilla-like formation. We have just the perfect gingival contour to be able to provide, well, a natural emergence profile and, of course, biomimetic aesthetics. And most important of all, well, we'll provide our patient with a radiant smile. And if we know that suffering souls, well, of course, they can't be fixed on the smile, but maybe there is a slight possibility that if you provide your patients with radiant smiles, well, you can bring some life to their souls. Thank you.